Shock and first aid treatment. Shock is a life-threatening condition that occurs when the body's tissues and organs are not receiving enough blood flow, leading to insufficient oxygen and nutrient delivery. This can result from various underlying causes and is broadly classified into four main categories: hypovolemic, cardiogenic, obstructive, and distributive shock. Types of shock. 1. Hypovolemic shock. This type of shock is caused by a significant loss of blood or fluids, leading to a reduction in circulating blood volume. Examples include severe hemorrhage, dehydration, or excessive fluid loss from burns or diarrhea. 2. Cardiogenic shock. Occurs when the heart is unable to pump enough blood to meet the body's needs. This can result from conditions like heart attacks, heart failure, or severe arrhythmias. 3. Obstructive shock. This type of shock is caused by a physical obstruction of blood flow, either within the heart or major blood vessels. Examples include cardiac tamponade, pulmonary embolism, or tension pneumothorax. 4. Distributive shock. Characterized by abnormal distribution of blood flow due to widespread vasodilation. This leads to relative hypovolemia, because the blood vessels can't effectively carry blood to vital organs. Subtypes of distributive shock include 1. Septic shock. Triggered by a severe infection that causes widespread inflammation and vasodilation. 2. Anaphylactic shock. Caused by a severe allergic reaction leading to massive histamine release, vasodilation, and increased capillary permeability. 3. Neurogenic shock. Results from damage to the nervous system, often from spinal cord injury, leading to loss of sympathetic nervous system function, vasodilation, and decreased heart rate. Symptoms of shock. Rapid heart rate. Rapid, shallow breathing. Low blood pressure. Pale, cool, and clammy skin. Weakness and dizziness. Confusion and anxiety. Decreased urine output. Possible loss of consciousness. Treatment. Restoring blood volume, administering intravenous fluids and blood products. Improving heart function. Medications to support heart contractions or address underlying heart conditions. Relieving obstructions, procedures to remove blockages or release pressure on the heart. Addressing the underlying cause, treating infections, allergic reactions, or neurological injuries. Shock is a medical emergency requiring immediate attention and treatment to prevent irreversible organ damage and death. What is the first aid treatment for shock? If you think someone's in shock, the very first thing you should do is make sure you're both out of danger. If you're not safe, move both of you to safety, however you can. Once you're safe, get help. That means calling your local emergency services number or sending someone else to get help. If there's no one else to send for help, do what you can to help the person in shock first. Don't leave them until they're as stable as you can make them, and even then, only leave them as a last resort. You should also remember, don't wait to call for help. Always assume a person in shock is going to get worse. Don't give the person anything by mouth, including food or drink, especially if they're unconscious. Don't move the person if they might have a head, neck, back, or spine injury, lest not moving them would put them in more danger. Also, avoid moving them if they have any visibly broken bones. And even if they don't have a dangerous injury, try to move them as little as possible. Unless you're a trained medical professional, you can't diagnose shock yourself. That means you can only react to 1. What a person in shock can tell you. 2. What you can see. 3. Any obvious physical signs, like not breathing or not having a pulse. The treatments for shock can vary slightly, depending on which type of shock you're experiencing. But when someone's unconscious, all shock treatments start with the ABCs. 1. Airway. Make sure their airway is open and clear, and tilt their chin up slightly to keep it open. 2. Breathing. Check if they're breathing or not. 3. Circulation. Make sure blood can circulate. It's absolutely critical to confirm these in that order. That's because you can't survive more than a few minutes if you aren't breathing, and you can't breathe if your airway is blocked. If the person is breathing, look for any potential threats to their circulation. If they have severe bleeding, try the following measures. If one doesn't work, move on to the next. 1. Apply direct pressure. Put a bandage on the wound and press directly on the wound. Don't hesitate to press hard, even if it's painful. Maintain that pressure until first responders arrive. 2. Pack the wound. Use gauze or bandage material and push it into the wound. Then, apply direct pressure on top of the wound itself. In an emergency, a towel or t-shirt works. 2. Stopping the bleeding is more important than worrying about infection right now. 3. Use a cinching method, like a Spanish windlass for wounds on limbs only. Tie a bandage loosely around the wound and insert a rod or stick just underneath. Wind the object so the bandage cinches tightly atop the wound. Once the bleeding stops, tie the winding object in place. 4. Use a tourniquet for wounds on limbs only. This stops bleeding by cutting off blood flow to the injury. You should only use this as a last resort, or if you need to quickly stop bleeding so you can do other life-saving care like CPR. If they are not breathing, if the person isn't breathing, the circulation step often means starting CPR. But if the person has severe bleeding, you have to stop the bleeding immediately so they'll have as much blood left in their body to circulate as possible. Once you stop the bleeding, you can then start CPR. Keep doing CPR until you can get an automated external defibrillator or AED and try to use it. If you don't have or can't use an AED, continue CPR until help arrives. Remember, CPR is very tiring. Swap out with others who can also do CPR when you need to rest. Other things you can do to help someone in shock: keep them warm. Use blankets or jackets to cover them. Elevate their feet by about 12 inches, lest they might have a head, neck, back, hip, or leg injury. This helps push blood toward their torso and head. It can make it easier to circulate blood to critical organs like the brain. Don't elevate their head. Treat specific causes. If a person is in shock because of an allergic reaction and anaphylaxis, see if they have something like an epinephrine auto-injector. Use the rescue position if needed. If they start to vomit, drool, or bleed from their mouth, put them in the recovery position. Thank you. Bye. Joshi Joseph.